Hello, I'm Ryan, one of the vets from Orange Vet Hospital, and today we just wanted to touch briefly on some anti-arthritic medications that we can provide for your dog. So I think as a vet, a lot of the time we have patients come in and they have severe arthritis going on. Sometimes in their spine is one common place that we do see, as you can see in this deconstructed skeleton of a dog, and the other ones being commonly the hips and sometimes the elbows. So today we just wanted to touch on a few products that we like to use as vets, and this is sort of where it all starts before we get into the long-term care, using anti-inflammatory drugs and things like that. One of the first products that I'd like to touch on is a nutraceutical called Foresight. And again, this drug is very, very effective at reducing inflammation in the joints and therefore making the quality of life far better for our arthritic patients. Again, these drugs are really, really well studied along with the Antinol, and there is a lot of proof to suggest that they work quite effectively. And again, all the vets here would agree with me that these guys, used in conjunction with one another or separately, work really well. Progressing from there, the Zydax is another drug that we like to use. The active constituent is a drug called pentacen polysulfate, and it works really effectively again and targeting very specifically in those joints. And again, like the Foresight and the Antinol, it looks at sort of more of the prevention rather than the cure, and looking at those dogs trying to get into their system earlier rather than later. So we've got a few different options there. The Foresight and the Antinol are oral medications given daily. The Zydax is a bit more vet specific, and we have to give those as injections. But again, this is sort of the starting point for most of our arthritic patients, and then trying to just slow down that arthritic process, as it can be quite debilitating for dogs, in the long term. So, moral of the story, take-home message from this video is that if you think your dog is getting a bit tender or a bit slower, not wanting to exercise as much, not wanting to jump off the ute, etc., come and see us, whether you want to chat to us on the phone or come in for a consult, and we can go through a few of these with you. And there's no harm in giving these, even if we're at a sort of a middle age and we want to sort of reduce that risk of arthritic process forming. So anyhow, I hope that was somewhat helpful for you, and give us a buzz at the hospital if you'd like to see us and chat about arthritis. Thank you.